So today we're talking about total knee replacements and the importance of rehab before and after surgery. So prehab before surgery is very important because you need to strengthen your muscles, keep the knee as mobile as possible prior to surgery, because coming out of surgery, definitely the leg is going to be weak, the knee is going to be weak. The glute muscles as well as the hip muscles are also going to be weak as well. So having prehab before surgery maintains somewhat of the strength of the muscle, allowing you to recover a little bit faster than if you were to not have prehab before. So right after surgery, you're going to first register or schedule yourself for a PT appointment as early as possible, because we want to try to get you in as quick as possible and start that treatment program. In the beginning, as many people will think that it's going to be torture or it's very painful, but it's not. We'll be very gentle with you in the beginning. It's more of we're focusing on increasing the range of motion and mobility of the knee as much as possible, because in the beginning it's very swollen and it's a prime time for when, if you don't move it, you're going to lose that range of motion. So we focus on definitely telling our patients themselves to ice the knee, very much so in the beginning, elevating the knee as well, and then coming to therapy to gain and focus on working the knee motion. So extension of the knee, the flexion of the knee, as well as re-strengthening or strengthening the glute and hip muscles as well. So we do have a very direct communication with our doctors. They let us know like what the patient-specific procedures they've gone through within the surgery, were there any complications with the surgery, and also if there's anything in rehab that we feel like can, let's say the person is on a specific protocol and they can advance from what they should be doing, then we will communicate that with the doctors to make sure it's okay, and the doctor approves and agrees with the program, then we'll go ahead and move forward. Every time I go home at the end of the day, I think about like the patients that I've treated throughout the day, like things that worked with the patient, and I was so happy to be able to push them to that new level, because a lot of patients come in, especially after a knee replacement surgery, they're afraid to, oh, before I couldn't stand up by myself, I had to use my hands to push and support myself, and after surgery, you'd be surprised, many of them don't want to do that. They don't want to get up without their hand support, and pushing them to take that extra step and be comfortable with just getting up from their chair is, it's not only rewarding for the patients themselves, but it's rewarding for the therapist to be able to encourage the patient to feel comfortable and confident in doing that. So it is definitely a rewarding on both ends, for the patient and then for the therapist.